If there's one thing that the Aam Aadmi Party government here in Delhi has tom-tommed as its biggest achievement over the last decade, it has been their health model. From government hospitals to Mohalla clinics, we were told that this was an example that they had set for the rest of the country, for the entire country, for all of India. But when today the new Delhi Chief Minister tabled the CAG report on healthcare in Delhi, it turns out that this so-called health model is not really in the pink of health itself. Rekha Gupta today tabled the report on performance audit of public health infrastructure and management of health services in Delhi. This audit covers secondary and tertiary hospitals in the state and examines the period between 2016 and 2022. What this report highlights is systemic inefficiencies that affect hospitals, medical colleges, and public healthcare schemes. So what are the findings that have now put a huge question mark on what was publicized all this while as the Delhi model of health? First, critical services are missing from some Delhi government hospitals. ICUs, blood banks, oxygen supply, and even ambulance services were found missing. Next, the much publicized Mohalla clinics actually have very poor infrastructure. Even basics like toilets and power backup are not catered for. Then we have the other extreme where there is a non-utilization of critical infrastructure in super specialty hospitals. So actually some stuff was bought with taxpayers' money and it lay completely unutilized. Delhi government hospitals have a long waiting period for surgery. This waiting period ranges from 2 to 3 months to even a year. Not just that, there's an alarming shortage of staff in all these critical services. Shortage that ranges from 20% in some hospitals to nearly 90% in others. The Aam Aadmi Party government, by the way, had promised 32,000 new hospital beds. But guess how much did they eventually add? 32,000 was the promise, and they eventually added a princely figure of 1,357, which is just 4% of the promise that they themselves had made.
अध्यक्ष महोदय, मैं आपकी अनुमति से राष्ट्रीय राजधानी क्षेत्र दिल्ली सरकार से संबंधित भारत के नियंत्रक एवं महालेखा परीक्षक का सार्वजनिक स्वास्थ्य अवसंरचना और स्वास्थ्य सेवाओं का प्रबंधन पर निष्पादन लेखा परीक्षा प्रतिवेदन वर्ष 2024 का प्रतिवेदन संख्या नंबर 3 की प्रतियां सदन पटल पर प्रस्तुत करती हूं।
In the name of health, this government has again done a corruption. Whether it's medicines, whether it's creating a health infrastructure, whether it's a time of COVID, whether it's time of a Mohalla clinic. This government has done a corruption and they played with the people's life also. I mean, life medicines, life care medicines, you've done a corruption in that also. In the name of construction of the hospitals, you have made only 3 hospitals in whole 10 years. And 48 crore rupees has been spent extra in the name of construction of the hospital. Where this money has gone?
जो रवैया अभी दिख रहा है भारतीय जनता पार्टी की सरकार का, वो काम करने का कम दिख रहा है और आम आदमी पार्टी को पेट भर करके गालियां देने का ज़्यादा दिख रहा है। मेरा कहना है कि जो सीएजी की सारी रिपोर्ट आप सामने रखिए, टेबल क्यों नहीं कर रहे हैं सारी रिपोर्ट टेबल करिए, विपक्ष को भी उस पर अपनी बात रखने का मौका दीजिए, सदन से सबको निष्कासित करके। ये पहली बार हो रहा है भारतीय राजनीतिक इतिहास में कि सदन के अंदर आज विपक्ष के सभी विधायकों को घुसने तक नहीं दिया जा रहा है।
So let's break down the CAG report on the Delhi health model further and focus on some key issues that affect the health of the Aam Aadmi and that same health that the Aam Aadmi Party government had claimed to champion. First, let's talk about the Mohalla clinics. They were the centerpiece of Kejriwal'S health policy and they have been found wanting on many fronts. Out of 81 Mohalla clinics that were inspected, 15 did not possess any power backup. 6 didn't even have medical inspection tables, and 29 didn't have any fire extinguishing equipment on their premises. The least that one can expect in any facility is to have basics like toilets, drinking water. Even if you can't get examined by a doctor, the least you can do is drink a glass of water. But out of these 81 Mohalla clinics, 1/4 or 21 did not even have a basic toilet. 10 had no proper drinking water facility. And guess what? Of the 1,000 Mohalla clinics that the Arvind Kejriwal government had promised to set up, only half of that number, about 523, were eventually established. After the infrastructure, let's take a look at the staffing. Such was the paucity of facilities and staff that it ultimately put an inordinate burden on those that were functional. As a result, nearly 31% of the patients who visited Mohalla clinics could consult the on-duty doctor for just about 4 to 30 seconds. Because there are so few doctors and so many patients that it literally was like a factory. 4 seconds, gone. 30 seconds, gone. 39% patients were somewhat luckier. They received the doctor's attention for a period between 31 seconds to about a minute. Only 12% of the patients could actually get a consultation in excess of 2 minutes. Are you even able to explain to the doctor what your problem is in less than 2 minutes? Imagine how will that doctor have examined the patient in 9 seconds. What this basically means is that 66% of the total patients who went to these Mohalla clinics between 2022 and 2023 could consult a doctor for less than a minute. 66%. So far you would have heard of instant noodles. This is instant healthcare, Arvind Kejriwal style. Now let's shift our focus to Delhi government hospitals. The CAG came down pretty heavy on the Aam Aadmi Party government for the management of such hospitals, which are visited, by the way, not just by poor people from Delhi, but also the neighbouring states. A total of 27 such state government hospitals were examined by the audit body, and out of these 27, 14 did not have ICUs, 16 did not have blood banks, 8 did not even have a regular supply of medical oxygen. Half of the hospitals that were examined didn't have a functional mortuary. 12 out of 27 hospitals were found to be operating without even an ambulance. The shortage of doctors and nurses is a story in itself. The lucky ones are short of about 21% trained medical personnel. The lucky hospitals just have a 21% shortage, whereas in some other government hospitals in Delhi, the shortage of doctors and nurses is as much as 96%. Another critical area of focus is essential medicines. Here too, some hospitals and clinics just did not have crucial antibiotics for diseases like HIV and tuberculosis. Cap rifabutin, which is used to treat HIV-infected patients, was not available for 161 days. Delamanid for TB patients was out of stock for 222 days. The CAG found that there was a shortage of injections for rare and fatal diseases like hemophilia and rabies. In the period between 2016 and 2022, hospitals had to procure almost 47% of the drugs in the essential drug list directly, because the Central Procurement Agency, which is the nodal agency to procure the drugs for these hospitals and Mohalla clinics, simply did not deliver. So essentially, these hospitals had to go out and get them on their own. There are many such instances, like when the COVID pandemic was at its peak in Delhi, there was an underutilization of COVID emergency funds. Only 582 crores were utilized. What was the total amount allocated? Almost 789 crores. Major hospital projects were delayed. The delay was as much as 6 years. There were cost overruns of about 382 crores. We can go on and on, because there were glitzy advertisements which highlighted a health model that was praised the world over. We were given ads which said how people from across the world are coming and visiting Mohalla clinics. The question though is, when those people visited, could they have seen the rot that had already set in within?